The smile has enhanced my look, and they're not exactly sure what it was I had done. It's probably given me a little more confidence, even though I thought that I was perfectly happy with the teeth and the smile I had. It just feels good to have it near perfect now.
Your smile. It's one of your most valuable assets. It can get you the job you want, let someone know that you love them, and basically it can make your life easier. My next guest can help you with all of these things. Dr. David DiLoretto and Dr. Robert DiPilla, welcome to Who Detroit.
Thank you.
Thank you for having us.
Now, you two are partners and come at this with helping people with their smile from a little different backgrounds. Tell me, Dr. DiLoretto, about your background.
Well, I grew up in dentistry. East Side boy, and father was a dentist. I remember watching him build the office. I was 3 years old.
And Dr. DiPilla?
My background comes from basically New York, and I was fortunate enough to work with some of the high-profile dentists in the country, and also clientele too. And the nice thing that I learned is that I can give back. That's one of the reasons why I came back to Michigan. Within the last 5 years, the technology, especially in dentistry, has come a long, long way. I mean, to see a screen like this, we can see things that we couldn't see before.
I found that with the technology, I could practice at a higher level, and that was a surprise.
The two locations that you have are not smile centers, if you will.
No,
They're your serious offices that do veneers and reconstruction, whitening, all kinds of things.
Yeah, we call it advanced restorative dentistry.
What about veneers?
I think of it as a thin sheet of glass, as much as sometimes less than a millimeter, that's covering the tooth with a new facing to give it its youth and beauty that it lost over time.
When would you use something like that? Say, I always had this little tooth that crossed over. I mean, would you use a veneer?
Well, you could do it for a single tooth, but usually we're doing 8 or 10 of the front teeth. And before we get started with that, it's the form and the function.
Exactly. Once you put the teeth in harmony and everything is balanced, look what happens to the lower lip. Look at this particular photo here and look at the one right over here. Look at her lower lip. When things are balanced, she feels comfortable.
Form and function is important, but you have to also be an artist.
Correct.
Because you don't want to look like Jim Carrey from The Mask.
Exactly.
Right?
Well said.
Exactly.
Okay.
I think the most important is, as far as being a diagnostician and also being a doctor, we have to recognize the eye color, the facial form. We can recreate the shape and the size of the teeth to fit for you, that's customized to you.
Dr. DiLoretto and Dr. DiPilla, tell me what you do for your patients who have to come and spend, say, a couple hours in the chair.
What we'll do many times is have the TV or a video that they would like to watch. They're on the headphones.
Also, we have a reflexologist that comes in and works on their feet.
When you talk to your patients, what are they telling you after they've had some of these various surgeries or changes in their mouth?
I mean, the best thing for us is we went beyond our expectations. To me, that's the most important.
How has it affected their lives?
It's changed their lives. We've seen young girls who wouldn't smile, and then we follow up with a subsequent picture of them, and they're smiling from ear to ear, and their hair and makeup is done. They feel good. That person is changed. We've changed their lives.
These are definitely two men who can help brighten your smile and just maybe your social life. Dr. DiLoretto and Dr. DiPilla, thanks for coming.
Thank you.
Thank you very much.
For more information on Who Detroit and our guests, call 1-866-WHO-KNOWS or visit us online at whodetroit.com.